Hello, everyone. It gives me great pleasure to introduce you to my dear friend, Phoebe Long. She is a professional kinesiologist, author of Breakthrough Approach Using 3Play, international faculty member of Breakthroughs International for Brain Gym and Movement-Based Learning, certified RMTI consultant, instructor, and recently appointed as observer and training the RMTI Level 1 and 2 instructor. She started learning RMTI in 2011 and since then is applying with children in her breakthrough enrichment station. Welcome, Phoebe. So
Thank
great
you
to
very
see you.
much.
So, Phoebe, I would like to ask you, what are reflexes?
Reflexes, many times we actually consider that as a primitive infant reflexes, which are stereotype automatic movement that baby does when they are newly born. Yeah, so these are the movement in the body that one person cannot control. Is that if there is a stimulus, if there is a change of body position, then the body will react. For instance, if there is a loud sound, the baby will they will start crying. That can be considered a moral reflex. And what the reflex do is to call for help. When the baby cry for help, then the caregiver come and help them. Is integrating of the moral reflexes. Yeah, so there are a lot of reflexes in life that is helping us to survive, to feel safe in this world.
And what are the different kinds of reflexes?
Well, there are 4 stages of reflexes. The first one is called the intrauterine reflex, where it actually emerge and complete the integration of the reflex while still in the womb. We call it the fear paralysis reflex. Then they will progress on to a primitive infant reflexes, where they actually emerge in the womb, but they integrate outside the womb. And in between the primitive reflexes and the postural lifelong reflexes that help us to survive in this world until our last day is called a transitional reflex that actually is a short period of time but it emerged after womb, after delivery, and it helps to provide the foundation for a person to complete before they actually develop the maturity and stability to develop the postural reflexes. Yeah, postural reflexes are there to help one person to protect oneself from instability. Like for instance, the head writing reflex, when we would to move our body, do our head also need to follow. Yeah, if our head is following, that says that our primitive reflexes has not complete the job. It's not integrated. Therefore, this postural reflex will also not be able to develop well. And so we call it the underdeveloped. So yes, there are 4 different stages or types of reflexes, and every reflex go through a process of emerging, developing, and then there will be a peak when the reflex are very active, and most of the primitive reflex at the peak is at the birth, when the baby have to develop out of natural birth through the to the birth canal, and that is a very important process. And therefore after they have a peak, after they develop and at the peak, then they will slowly diminish their activeness and then integrate the reflex. Some people call it assimilate, some people call it inhibit, some people call it integrate, but they are all the same, where the primitive reflex will stop functioning so that the postural reflex may take over.
And Phoebe, you have been practicing RMTI, rhythmic movement training, which is reflex integration course, since 2011 in your breakthrough enrichment station, which is, I am aware that it deals with children with special needs. So when they come to you, what do you see that if their reflexes are not integrated, what are the things that you see? What are the signs and symptoms? Some of them, just if you could tell us.
Sure. Well, many parents who send their children to us is because the child mostly may have focus and attention issue. They can't sit still in the classroom. They walk around, or they are not able to focus for a short while on the table task. Then they will leave the place. But recently, I noticed that many children who come to us will have some emotional issue and impulsivity. They are very impulsive, they scream, they shout, and they do things without control. Yeah, and of course, there are also children who have reading and writing issue where they actually couldn't process information. They can say things, but they cannot understand people say. So there are just a wide range of children right now who have challenges, and because when we address the reflexes, we actually help them to build a foundation. Yeah, so children who comes with they do not have the foundation, they actually struggle because the primitive and the postural reflex are constantly fighting to do a task that they should be able to do if they have developed successfully in the milestone. But if the reflex are still retained, therefore they do not have the resources and ability, like for instance, copy words, they may not be able to develop well, or they may not be able to spell well. Yeah, or they may easily trigger with a sound or with a tap. They get upset. They can go into tantrum or even meltdown. Yeah, so there are many of these children who are suffering outside in the world that may not have the understanding that the reflexes are still not integrated.
And would you say that steaming behavior and speech issues are also related to reflex integration?
Certainly. So, what is this? Right? This is one we call steaming, and what would adults would say to these children? Say this is inappropriate behavior in the public place. So what do we normally do? We say that put down your hand, because that is what we felt that is appropriate. But why is the child doing this behavior? So for us, steaming or hand moving is basically telling us that the child's pull to sit or the palmar grasp reflex are still not integrated. So when they are overwhelmed, when they are happy, sometimes parents say that they are happy, they do this, or they are sad, they do this. It's because their body has learned by doing this kind of behavior, they feel safe in their body. And again, that is why reflex is meant to help us to feel safe. It is appropriate for a period of time when the baby are still small. But if it carry on until when the child is still doing steaming at 15 years old, that shows that the child's underlying foundation of integrating of the reflex have not been addressed. Rather, they have learned to suppress or submit to certain behavior modification approach by not doing it, but yet it's not helping them to feel safe. Yeah, so this is from my perspective. I have seen that when the child have their reflexes integrate, they do need to sleep. They already have resources how to stay calm without having to do those stereotype or automatic behavior.
So, Phoebe, would you say is it easy for parents and special educators and physiotherapists to learn about reflex integration?
Certainly, because this reflex integration movement that is introduced in the Rhythmic Movement Training Internationals are replicating baby movement. Yeah, baby movement when they are lying on the floor on a flat surface, how do baby rock themselves, or even while the baby is in the womb, then they actually rock because of the mother breathing, the walking, the heartbeat is giving the baby a rhythm. But now, after the baby was born, and then if they do not have sufficient stimulation in the womb, we can replicate the movement by using the RMTI movement to do the passive movement, and so that they have enough resources to stimulate the tactile, vestibular, and proprioceptions within the inner sense, and therefore they will have more resources for muscle tone. They have more resources to develop the far senses, such as the vision, the hearing, the taste, the smell, and even the touch after birth. All these are important. So what are these movements? These are simple movement rocking. Just gentle rocking while a person lying down. And then when they have more resources, they can start doing the movement actively. And when they have the resources to do the movement actively, then they can transit into the kneeling and sitting position movement. It is so simple. Parents are saying that it's so simple and yet it's so profound. They say that by just doing some simple rocking, and my child could sleep better. By just doing some rib cage rocking, now he can breathe better. And yet many people do not know of this technique. Let me share with you. This is a comment from a professor who is a retired professor that served in the intensive care unit ICU. So when she come for my class, I'm actually very curious. She knew about all the reflexes. She knew a lot of techniques that she has learned and taught many of her students. And when she come for this RMTI training, I pose a question. Why? I'm curious to know, why are you here for this class? Because you have far more knowledge for me. She says that, yes, we the professional knows that all these reflexes, but when I support the patient in the ICU intensive care, I felt that these are very important techniques to also enable the parents to gently rock the child, to reconnect with the child. And it shows so much result when the parents learn this simple technique, and giving hope to the parents to say that you can still be in connection with the child. So I was very encouraged by her comment. And yes, so right now I have many patients that was referred by osteopath, dentist, even the ENT surgeon, who find that when they're treating the patient, when the treatment is stagnant and couldn't progress further, so they invited their patient to learn about the reflex integration, and they are seeing lots more result, and the children are progressing better in the treatment. So I hope that this encourages some of you there who find that what other things that you can do to be in connection with your children or your student. Yeah, come and learn about the reflex integration program from the RMTI.
So that's a great tool. From what Phoebe's saying, it's a great tool that parents, special educators, physiotherapists, occupational therapists, as well as even doctors can attend and learn and add to their toolbox. Thank you so much, Phoebe.
You are most welcome.